You're watching Arab Health TV, and we're very kindly joined by Sarrah Barakat, who is the Government and Public Affairs Director for Merck Gov, as we're learning a little bit more about pre-diabetes and diabetes screening here in the UAE. Thank you very much for joining us.
Thank you, Abdullah, for having me.
So, Sarrah, talking about the HbA1c tests and your ambitions of increasing the sample size in the UAE, what's been happening?
Well, for the last year and a half, we've been working with the Ministry of Health and Prevention to screen as many people as we can, to give them an informed decision on their lifestyle and how they can take action against developing diabetes. So using the most advanced point-of-care machines, we've been able to give people a diagnostic HbA1c test within 8 minutes. And following that, if their HbA1c is outside of the normal limits, they have access to a full clinical team on site that can give them lifestyle modification and advice on how they can take more control over their blood glucose levels.
And how does this work? How does this test work? Because you mentioned that it doesn't draw too much blood out. Well, how does it work?
Yeah. So normally when you would go to a pharmacy, you would do an instant finger prick test, and that would give you a snapshot in time of what your blood sugar levels were doing in that moment. However, to get a true diagnostic retrospective analysis of your blood for the last 3 months, you'd need to do an HbA1c test. Normally that would take a venous extraction of blood, sent off to a diagnostic lab, and then you would get your results in 2 to 3 days. Here we're able to give you the tests and the results within 8 minutes.
Amazing. And lastly, your ambitions of screening more than 500,000 people now?
Yes. So initially we were set a target by the Sheikh Mohammed bin Rashid Government Accelerator Program for 5,000 people in 100 days. We smashed that target and we reached 12,500 people in 100 days. The next target was 100,000 people in a year. Again, we smashed that on November the 14th, World Diabetes Day, and we screened 150,000 people. So our next ambitious target is 500,000 people by the end of the year.
Brilliant. Thank you very much for joining us today.
Thank you so much for having me.